Have you been to a chiropractor or considered going to a chiropractor and wondered, how does adjusting the spine really work? Don't worry, you're not alone. This is a very common question that we get. And I'm going to go over this in a little bit of detail today. Hi, my name is Dr. Matthew Collins. I'm a chiropractor and board certified in rehabilitation and a fellowship trained in primary spine care. So let's look at this topic of just what happens when we adjust the spine. On the surface, doing the adjustment or watching somebody else being adjusted, it can look really simple. It's a lot like playing golf. It's a little tiny club, little tiny ball. How hard can it be? And yet you find out it's really, really difficult to do. So learning how to adjust the spine really takes a lot of training, skill, and education. So first of all, we have to understand what happens when we go in and do the adjustment. So the first thing that the chiropractor does is called preload, and that's where you go in and you get the joints basically ready. So you just can't go in and blindly start working on the spine. The doctors have to select the right level, and then they have to go in there and they have to move the joint. And sometimes this is also called tolerance testing. That's where we're making sure that the patient is actually able to tolerate about what is about to happen. So we want to make sure that the patient is comfortable. And you can tell from the patient's response as we're setting up, getting ready to do the work, whether their body is ready and willing to take it. The next thing, once we set the spine up, is then the thrust is delivered. And it's a very short, precise, there's a certain direction that needs to happen, and there's a certain velocity that needs to happen into the spine. And that thrust that goes in there, it moves the joints, moves the tissues, moves things in the direction that needs to go and restores motion. So that's the second thing that happens. And then the resolution part of it is where everything just kind of settles down. So if you've ever been to a chiropractor, it's usually a three-part step. First, there's the selection, there's the preload, the doctor does the adjustment, and then your body relaxes for a moment or two afterwards and you feel everything kind of settling down. So this all happens very quickly, but there's a lot that happens underneath the surface while this is going on. So the first thing that happens is at the joint level, so where the doctor has his hands, at the joint levels, we want to get what's called gapping. So I've got a model here I'm going to show you. This is a plastic model. These bumps right here, the bumps that you feel in the back of your neck, and this right here is the joint on the right side, and this would be a joint on the left side. I have another model here that's a little bit more complex. You can see how we've got a healthy joint that's covered here with ligaments, and then over here it is red and inflamed because it's injured. So what we try to do is we try to get the joints to open up and we try to get them to gap. And when that happens, we know that that is kind of where the magic occurs. Opening up those joints really has been shown to be very effective at relieving symptoms. So once again, we're trying to get just a little bit of motion in and around those joints. Now, sometimes at the joint level, where there's all the ligaments and stuff, there's little tiny pieces of material called meniscoids. And sometimes those tissues can get impinged or locked inside the joint. So by going in and moving it around, you can get it to gap. And that's oftentimes where you'll hear that pop or that click that occurs when the doctor goes in there and adjusts the joints. Sometimes, depending on the different type of adjustment that's selected, there is no pop and there is no click, and there still can be significant pain reduction. So there's a lot going on, and that's what's happening kind of at the joint or at the bone level when we do the adjustment. So this is just a brief overview, and there's a few other pieces to the puzzle, and we'll go over those in later videos. Thank you so much for watching this video. I hope you found it informational, educational, and I look forward to seeing you on the next one.